A delusion is a fixed, false belief held with strong conviction despite clear evidence to the contrary. Delusions are symptoms of some mental disorders, such as schizophrenia, delusional disorder, or mood disorders with psychotic features. The delusion of theft is one specific type, revolving around the steadfast belief that one's personal belongings or property have been stolen, even when there's no evidence to support such a claim. This delusion can be persistent and resistant to contrary evidence. For instance, an individual with this delusion might accuse family members, caregivers, or neighbors of stealing items, even when these items are found, or their absence is rationally explained. Several conditions and factors can contribute to the development of delusions of theft. Neurodegenerative disorders, especially Alzheimer's disease and other forms of dementia, are common culprits. As cognitive function declines, patients might misplace belongings and then, unable to remember where they put them, become convinced that the items were stolen. Psychiatric disorders like schizophrenia and mood disorders with psychotic features can also lead to this delusion. Additionally, changes in living situations, such as a move to a new residence or nursing home, can provoke feelings of insecurity and unfamiliarity, potentially triggering delusions. On a neurochemical level, disruptions in neurotransmitters like dopamine and serotonin in the brain can contribute to the emergence of delusions. The delusion of theft can be distressing for both the individual and those around them. Accusations can strain relationships and create an environment of mistrust. Those accused, often close family or caregivers, may feel hurt, bewildered, or frustrated. From a caregiver's perspective, it's challenging to navigate these accusations, as responding defensively or with anger can exacerbate the situation, while simply agreeing may not always be beneficial. Managing the delusion requires a multifaceted approach. Education plays a pivotal role. Understanding the nature of delusions and their causes can foster empathy and patience. Recognizing that the accusations stem from a medical or psychological condition, rather than malicious intent, can change how one responds to them. Making environmental adjustments, such as keeping spaces organized and reducing clutter, can minimize the occurrence of misplaced items. Labeling drawers or even using tracking devices for frequently lost items might be beneficial. Professional support, including mental health professionals, can offer therapeutic interventions and medications, if appropriate, to manage the underlying conditions contributing to the delusion. Caregivers can also adopt strategies like validation and redirection. Instead of directly confronting the delusion, they can validate the person's feelings and then gently steer the conversation in another direction. In conclusion, the delusion of theft is a symptom that can arise from various underlying conditions. While it poses challenges, with understanding, patience, and appropriate strategies, its impact can be managed and minimized.